The Chief Executive of the UK Health Security Agency, Dame Jenny Harries, has warned that the number of people being admitted to hospital with COVID is expected to rise further. The latest UK figures showed that infections jumped by more than 500,000 in a week. Our health editor Hugh Pym gave us more detail on Dame Jenny's comments.
She's acknowledging that there is another wave at the moment and that it's not finished, and she's saying if you look at the numbers, she didn't give a time frame on this, but there could well be more in hospital with COVID than there were back in March. That was the previous peak, around 16,500. It's currently around 9,000 in hospital now. So it's a warning, it could be higher because it's fueled by these new variants of the variant Omicron, which spread more rapidly. Now, it has to be said, if you look at the hospital numbers, they are not all by any means people who've gone in primarily because of COVID. A certain number of them have other conditions and then tested positive, but it does put more pressure on the NHS, and NHS providers representing trusts in England have said this means there'll be a bumpy ride over the coming months with existing pressure already there in the NHS. Dame Jenny Harries also warned that the flu season may come earlier in the autumn as well as another COVID wave. So certainly rather a cautionary note from her today.
And joining us now is the expert in infectious disease management and senior clinical lecturer at the University of Exeter Medical School, Dr. Bharat Pankhania. Dr. Pankhania, good to see you, although sadly we are still talking about this latest iteration of COVID, this latest strain. What do we know about it and how it compares to other variants?
So we're talking about the BA4 and BA5 variants of Omicron, and what happened in the United States is it started to spread, and then like a chain reaction, the more cases it generated more and more and more, and it became the dominant variant in the States. And now similarly in the United Kingdom it is doing the same. The good thing is that the vaccines still have a margin of protection against BA4 and BA5, but we mustn't get serially infected, because then there are other consequences of getting infected.
What do you mean by a margin of protection?
Great question. So when we invented the vaccines were invented against the Wuhan strain that was circulating. But since the Wuhan strain, we've had Alpha, Beta, Delta, Omicron, and now BA4 and BA5 versions of Omicron. So the further away you drift from what you were immunized against, the number of antibodies that we have decreases, the number of effective antibodies against the circulating strain. So it's the number of effective antibodies in circulation.
So anyone who's due to get another jab, another COVID jab, will those vaccinations be treating these later strains or not?
So the vaccines have not changed, and therefore what the booster does is it makes more of it. So when you have more of those antibodies, the few that still carry on working are there, and then they do their job. But I think now, because we've had so many variants that drift from Wuhan to Omicron, we also need to reformulate the vaccine and mirror the vaccine to what is in circulation.
So should people feel that, if they're in otherwise good health, that they are well protected, or would you like to see people taking some additional precautions in crowded places because of these variants?
No, we must always take precautions, because the other bit that I wanted to say is serial infections can also act as a autoimmune response, and then you may end up with what we call long COVID syndrome. So we don't want to do that. The best we've got are the vaccines. Avoid crowded places, wear your mask, and then of course we've got the summer holidays now. So if you are traveling on a crowded aeroplane, bus, train, etc., please, before you go, buy yourself a good quality FFP2 mask and wear it properly on those crowded places.
Okay, Dr. Bharat Pankhania, thank you very much for your time this evening.
Thank you.